Hi, thanks for joining me. This is Barbara Harper, founder and director of Waterbirth International, and I'm recording this live on Sunday afternoon, March 29th. I have cooperation from Birthpedia and lots of midwives over this last week. I sent out an article for review called Keeping Waterbirth Safe During COVID-19. Let me just tell you how this started. About a week ago, a midwife from Italy sent me a WhatsApp message, very disturbed that her hospital had asked her to stop using the tubs for labor and birth. She, in her message, said that about 80% of all of their clients at that particular hospital labored and gave birth in the water. She wasn't sure why they stopped the practice, but she had some suspicions, and she asked me if I could help. I turned the light back on because it was 2 o'clock in the morning, and I answered her message. And I'd like to read you what I wrote to her. All of the research shows that water reduces the rate of infection in all three participants: mother, baby, and provider, and in some cases makes contaminants non-viable. In other words, you can't spread a virus, and we'll talk about that later, about HIV and AIDS and group beta strep and all of those things that we have actually had the benefit of researching. So I shared with her my knowledge about infection control and concluded that I recommended that they continued with their established hospital water birth practice, and where and when necessary to use full protection equipment. So that's how this started, because that was on Friday. On Saturday, a joint commission of the Royal College of Obstetricians, the Royal College of Midwives, and the Royal College of Pediatricians and Child Health Providers in the UK published a 43-page paper stating the use of birthing pools in hospitals should be avoided in suspected or confirmed cases, given evidence of transmission in feces and the inability to use adequate protection equipment for healthcare staff during water birth. So when that was released and it started filtering through the world in midwifery and obstetric circles, everybody started putting yellow caution tape on their tubs and said, don't use them, we don't know enough. And by Wednesday, I had started drafting an article, doing research, and calling people in different parts of the world. I actually did a survey of practices in Italy, Iran, Turkey, UAE, United Arab Emirates, UK, Canada, and US, Mexico, and China. I have contacts in 120 countries, so it wasn't hard to send out messages to people. I was happy to get responses from everybody right away. The UAE and Iran suspended their water birth practices. Water birth practices by Wednesday had not been completely suspended in the UK, but there was difficulty and discussion, supposition about what one could do and how to mitigate any possible bringing home of infections. And one of the midwives that I talked to last week gave me a whole list of her concerns, because she talked to everyone on the busy unit in this hospital in the UK. And then I also started talking to midwives in the US. And one by one, they kept sending messages, Facebook, WhatsApp, emails, Messenger. The messages just started coming in, and I started telling everybody, I'm writing about it, I'm writing about it. So this is what I want to share with you. Granted, no baby is going to wait for us to do 2 months of research. Babies are born today, tomorrow, next week, next month. And in this mire of not knowing whether we're going to contract the virus ourselves, midwives and obstetricians and obstetric nurses are on the front line. And I want you to feel as safe as possible. So that's why I've authored this article. The article will be posted with this video. You'll be able to download it. It'll be in a PDF. You'll be able to share it. And I want your comments and sharing it all around the world. We're already translating it into Spanish, and we'll have that back. So after the RCOG in England published their work, this midwife in the UK concluded her list of concerns with that due to uncertainties, midwives do not want to increase the potential risk in this unprecedented time. And I understand completely. And we have had protocols and exclusion criteria and inclusion criteria for hospitals and home birth practices all around the world for the last 30 years. If you're a home birth midwife and you don't have a protocol for water birth, when this is finished, write your protocols, have them, and be done with it. And one of the things that I've suggested and have also produced for wide distribution is an informed consent for water birth. Most hospitals require it, most home birth midwives do not. However, I don't think it's a bad idea. I do think it is a good idea for an informed consent, which includes the information available about safe practices with water birth. So one of the standard practices of getting into the tub is if you are presenting with a fever of 38 degrees Celsius or 100.4 degrees Fahrenheit for longer than 4 hours, we don't want you in a hot tub. It's an exclusion. And so if you show up either at a hospital or at home with a fever, you're not going to be allowed into the tub at all. And fever being one of the symptoms of COVID-19, but not necessarily proving that you have COVID-19, here comes the question. One of the biggest things that keeps midwives from offering water birth right now is the lack of testing. If we don't know if you're asymptomatic and a carrier, or you might have a fever, but it might be the flu, or it might be just stress, something like that. However, knowing whether a person is infected is the key to creating your policy on the use of hydrotherapy in labor. Many places are assuming that everyone is a suspected positive, and they put into place precautions that would limit the contamination of healthcare providers. Women in Shanghai, China had a 10 to 30% false negative. This came from a online workshop that a friend of mine attended. I did not attend the workshop myself, but I saw the results of the workshop and looked at them carefully. So that's when they first started testing. And once they had serology or blood work testing, that rate of false positives dropped exponentially. However, it takes 7 days to get a blood test back. And in that first 6 days, that's when you might be most communicable. So eliminate women from your Waterbirth program who have a fever, number one. Let's talk about the water itself and what the CDC thinks. The current Center for Disease Control and Prevention updated their coronavirus information on their website. You can go, we'll provide a link to that website so that you can go right to that page. And this is what they state. The COVID-19 virus has not been detected in drinking water. Conventional water treatment methods that use filtration and disinfection, such as those in most municipal drinking water systems, should remove or inactivate the virus that causes COVID-19. You are going to be filling your birth pool, in most cases, almost entirely throughout the world, with a municipal water supply. Some hospitals in China that I've been in have entire filtration systems for just their maternity units. And so it's anything that would be contractable, that would that you would think would be in the water source, is not going to be there. That's number one with the CDC. So if you have any further question about the susceptibility of the water itself, you can always add 2 tablespoons, which is equal to 30 milliliters, which is equal to 1 ounce of household bleach. If you add household bleach, 2 tablespoons, 1 ounce, 30 milliliters, to a tub anywhere from 70 gallons to 110 gallons, or 300 to 400 liters of water, that is enough to kill any bacteria, virus, and make it inoperable through the water. The question that comes up about adding bleach is the woman should not get in the tub for at least an hour while it evaporates and ventilates. And so let's see what else the CDC has given us about COVID-19. So make sure that anything that comes into contact with water is either disposable or cleanable. Your hands are cleanable, your gloves are disposable. Anything that splashes on you should be cleanable or disposable. If you're not wearing full protective gear, have clothes that you can change into. So additionally, the CDC states there is no evidence that COVID-19 can be spread to humans through the use of pools or hot tubs. Proper operation, maintenance, and disinfection with chlorine of pools and hot tubs should remove or inactivate the virus that causes COVID-19. So good hygiene with proper cleaning, as during any time of using birth pools, not just now, will increase the safety of water immersion. The CDC has maintained this position about the use of pools in hospitals and for home birth for a very long time. I contacted them as early as the year 2000 to ask this very specific question. And in 2009, I had a personal communication with a researcher at the CDC, and we were talking about specifically HIV, hepatitis, AIDS, all of those things that could potentially go into the water. This is why we were forming our original protocols and distributing them widely throughout. And one of the exclusion criterias in most places is any blood-borne infection, any skin infection, and any respiratory infection that has not been treated. So that takes us to the discussion about this upper respiratory infection and whether or not, once again, we have to go back if you're not testing, you're just assuming everybody is positive. And if that's the case, then you're probably not going to be using your tubs. So there's one more thing that the CDC talked about and is on their website. The risk of transmission of COVID-19 from the feces of an infected person is also unknown. However, the risk is expected to be low based on data from previous outbreaks of related coronavirus, such as severe acute respiratory syndrome, SARS, and Middle East respiratory syndrome, MERS. There have been no reports of fecal-oral transmission of COVID-19 to date, and that stands as of today. So the potential for infection if a woman lost stool in the tub has always been a discussion. Every Waterbirth certification course that I teach, whether I'm in China or the Middle East, Israel, I don't care where I am, I have a slide that says the solution to pollution is dilution. And if a mother poops in the tub, even in this case, number one, the water is going to be a safe place. And the amount of dilution that happens with this, and I know we'll have arguments from some people about it, and yes, I'm going to conclude that if you want to stay safe, don't allow a woman in a tub completely. However, you can trust the water. The water is not only the great liberator, but the water is the great protector. It's a cocoon. It protects this woman, and if she releases stool in the tub when she's pushing her baby out, that is going to be diluted, and the chlorine that's in the water in and of itself is going to deactivate any possible bacteria or virus that might go into the water. The literature on the infection rates of infants and mothers after birth are quite convincing. And I just want to go over 3 meta-analyses. These were all published within the last 3 years. And they were very well researched in the sense of taking a wide swath of studies and creating particular parameters to be included. And one of them was NICU admissions and postpartum infection rates. So Vanderlaan and Hall et al. Found no increased odds of poor neonatal outcomes with water birth compared to conventional delivery practices. The analysis revealed this finding was stable for many outcomes, including neonatal infection rates. And Davis and Davies looked at neonatal sepsis infection, including fever and other infection markers, as defined within any studies, within 7 days of birth, along with 9 other parameters. They concluded there is no evidence to suggest that the practice of water birth in a low-risk population is harmful to the neonate. Taylor and Sutcliffe sorted through the available evidence and created the final meta-analysis concluding no significant difference in neonatal mortality, neonatal intensive care unit, special care baby unit admission rates, APGAR scores, umbilical cord blood gases, or infection rates was found between babies delivered into water and on land. So we've got these three meta-analyses that all came up with the same conclusion, that being born in water had no increase in infection rate. So the significance of these meta-analyses contribute to our confidence of using water even during this time. The last two studies that I want to mention, and I do mention in the article, are both from Zanetti and Zanetti Dallenbach in Switzerland, looking at the colonization rates of newborns whose mothers birthed in water, and those mothers were group beta strep positive. And the conclusion of those two studies were that the water would have a dilution or washout effect. That was what the presumption was. And the test was done, the randomized controlled trial, and with a trend, what they found was that the colonization rate of the newborns was less, and with a trend towards less colonization in the water when compared to a comparable group of positive GBS women who birthed on the bed. So there was a dilution factor to take into consideration. This is not hard science. This is a lot of emotions that come up. When it's also important to remember that the use of water for labor and birth has a 30-year history, actually 36 years in my own case. My own son was born in water 36 years ago. And then we were doing it out of trust and faith with a hope that it would be a gentle experience. And now we know, and we have over 400 published medical articles that tell us that it's safe. So creating a ban on the use of birthing pools needs to be based on that scientific evidence and not a feeling of a theoretical risk or a presumption of fear. The very first contraindication to birthing in water is provider fear. If you're afraid of it, don't do it. Number one. So this is an extremely perplexing time in every single area of healthcare with many variabilities, and those variabilities change from day to day as we get new information or new testimonials. But do what you know, what you trust, and what you need to do to guarantee your safety and the safety of your families if you're on the front lines. So let me conclude. The deciding factors are true risk versus available resources for those going into homes. You have the toughest job because you're putting you and your family at risk just going to somebody's house. However, those in the hospital are doing the same thing, but in a different sphere. So if you have a way of testing your population, or if you have women who are presenting at term with normal physiology, with all the acceptable variations, no signs of COVID-19 infection, and no history of being in Europe or China, no history of exposure, you may feel free to continue using your birth pools, provided that they are cleaned according to a standard protocol between uses. I will also post a cleaning protocol just so you have some reminders of how to clean every piece of your equipment, your drain pump, your hoses, remember, it has to be cleanable or disposable. Try to keep a hands-off approach to care of the laboring person and exclude family members from entering the water with the mother. And do consider adding that 2 tablespoons or 1 ounce or 30 milliliters of household bleach if you have any concerns about contamination of the water. Continue offering care with which you are most comfortable. If your facility cannot make available personal protective equipment for all maternity care providers for positive or presumptive positive birthing people, don't offer water birth. If that is the policy that is enacted in order to deal with this situation, we can all accept that. However, based on the available evidence, the use of hydrotherapy should not be eliminated where possible, and birth in water is probably safer for all concerned. So using water might just be another layer of complexity that might push the provider to their limit. You're dealing with so much now, and I understand if you need to put that yellow caution tape on the pool. But what happens if you're in a hospital that now doesn't have enough anesthesiologists because they're all intubating COVID-19 patients, and you have no epidural available? Then you're going to have to fall back on using the water, using your personal protection equipment, because the water is going to be that woman's best friend under every circumstance. Staffing and the lack of personal protection equipment may be your deciding factors. So I wish that some of our researchers will keep track of the rate of infections in water during the COVID-19 era. And I know some people are already conducting surveys. My dear friend Jennifer Vanderland is doing that. If you get a survey from her, please answer it. Knowing how valuable this form of comfort and relaxation is for labor and birth, we must keep it available after this is all over, and for those who truly need it. So I want to answer every single one of your questions and go over the cleaning protocols if we need that, and go over the informed consent if we need that, and to field your questions about your personal practice. So WhatsApp, website, my website, waterbirth.org. I also have a series of videos about Waterbirth on birthpedia.net. You can go there and you can leave questions there as well. They will get to me. Facebook Messenger. Look, I'm not going anywhere, so I'll be here to answer all of your questions. And I hope that this puts a little bit of calmness into your life, and just know that we will get through this, and water is one of our best friends for mothers in labor and during birth. Thank you. God bless. Stay safe. Keep your family safe.